Hello, boys and girls. In the next few minutes, you will see stories of some children who get sick or hurt and come to Riverview Medical Center. The first story is about a little boy, Joey, who has a breathing problem called asthma. While playing football with his brother, he has to sit down because he begins to have trouble breathing. His sister sees what's wrong and decides that Joey needs help fast and uses her cell phone to call for an ambulance. The sister dials 911 and tells the operator the following information: her own name, Joey's name, and the address of the house. Then she tells the operator why Joey needs medical help.
My name is Emma Johnson, and my brother Joey's having an asthma attack, and he's having trouble breathing. We need help now. Our address is 456.
The operator tells Emma to go stay with Joey until the ambulance arrives. The ambulance pulls up to the house with 2 paramedics. An ambulance is full of medical supplies and equipment to take care of people of all ages. Paramedics are people trained to know how to use all of this equipment. The paramedics find out what might be wrong with Joey and decide that he needs to go to the emergency room. The paramedics carefully put Joey on a cart, and just like you do in your car, they use seatbelts to make sure Joey will be safe. Joey is placed in the ambulance, and one of the paramedics will stay with him during the ride to Riverview Medical Center. The ambulance arrives at the hospital and drives into the emergency room garage. While Joey is riding in an ambulance, his mom came from work to meet him at the emergency room. Joey is wheeled into one of the rooms of the emergency department. The doctor comes in and listens to Joey's breathing and does a complete exam, also looking in Joey's ears and throat. The doctor tells Joey and his mom that he will need a breathing treatment. A respiratory therapist gives Joey some medicine in a special tube that looks like a pipe. The pipe makes a mist that will help Joey breathe better. After this treatment, the doctor will check if Joey is feeling better and if he is able to go home. Let's listen to one of the nurses describe what you would see in one of the rooms of the emergency room department and show us some of the equipment used to treat boys and girls that aren't feeling well.
There's a lot of equipment in the emergency room setting. It kind of looks messy in here. Nothing's really put in cupboards. It's because we need to have things available and on hand quickly. When people are here for an emergency, we need to be able to get to serving them and treating them right away. So some of the things you might see in the emergency room setting are a blood pressure cuff, and this would be put around your arm so that we could take your blood pressure. Other things you might see would be an otoscope, which this is used to look into your ear. It looks like a flashlight when the physician's using it to look into your ear. Also, they would be looking into your eyes. Again, a flashlight type equipment. And you will also be getting your temperature taken with a probe being put underneath your tongue. You will see later a child with a cast placed. In order for us to get the cast off, we use a super smart saw that does not cut skin. This is the cast saw. The cast saw is very loud because it is sucking up all of the dust from the cast. And I want you to hear how loud the saw actually sounds.
Our second story is about a young girl, Amy, who broke her leg while playing at home. Her mother brought her to Riverview's emergency room. The doctor looked at her leg and decided to have an X-ray taken. Amy is taken from the emergency room to the X-ray department. An X-ray is a special picture that shows the bones inside your body. When taking the X-ray technician moves the X-ray camera above Amy's leg. Amy's mom is able to stay with her during the X-ray. After the X-ray picture is on the computer, the doctor shows it to Amy's mom and explains that Amy will need an operation to fix the bones in her leg. All the patients that go to Riverview Medical Center must have an armband placed on their wrist. This has your own name on it, your birthday, and your doctor's name. This is very important because of how many people we take care of every day at Riverview, and our staff want to make sure you get the right medicine. To prepare Amy for her operation, the nurse attaches a thin tube called an IV to the vein in the top of her hand. The IV tube will be used to give Amy medicine during her operation. Now it is time for Amy's operation. The operating room is filled with medical equipment the surgeon will use to fix Amy's leg. In the operating room, the staff wears special clothes, masks, and hats to make sure there are no germs that could get Amy sick. A clip attached to Amy's finger is one of several pieces of equipment used to keep watch of Amy's breathing and heartbeat during the operation. When they are ready to begin the operation, a mask is placed over Amy's face to give her medicine that helps her fall asleep so she won't feel anything while the surgeon fixes the bones in her leg. When the operation is over, Amy wakes up in a room called the recovery room. A nurse checks to make sure she feels okay. When Amy is fully awake, she rides in the elevator to one of the hospital's patient rooms, where she and her mom will stay in the hospital overnight. Amy's room has a nice bed for her, a sofa bed where her mom can sleep, and a nice bathroom. She will have her own TV and buttons to push if she wants to sit up in bed or call for her nurse. If Amy feels up to it the next day, she will be able to go home where her leg will finish healing. Sometimes your doctor needs to test your blood to find out what is making you sick. To do this, a laboratory technician called a phlebotomist takes a tiny sample of blood from your arm. It feels like a mosquito bite that lasts just a few seconds. Your blood is then taken to Riverview's laboratory to test it for an infection or viruses. This way, the proper medicine can be given to make you feel better. There is another part of the hospital where many of you may have stayed but don't remember. It is called the Riverview Family Birthplace, and it is where babies are born. If you have a brother or sister born at the family birthplace, you can go visit if you are feeling well. Joey and Amy are running and jumping thanks to the wonderful care they received at Riverview Hospital. Like Joey and Amy, you too may need to come to Riverview Medical Center because you are sick or hurt. Our doctors and nurses will be here to take the very best care of you.